One of the things I would say, whenever I think of our oncology nurses, our oncology nurse navigators, really the unsung heroes for patients. And I say that just, personal experience, but then years of talking to patients. And one of the things, we always advocate for is that patients, are prepared, that they know the questions to ask, that they, are an equal partner in their care. And without exception, patients always come back to us and say, thankfully, my oncology nurse, my navigator, they were the ones that made sure my voice was heard. And that means so much to a patient because, when you're diagnosed with cancer, you feel it's just you're out of control, like you have no control. But just understanding that you can be part of the conversation, that you can, make sure your voice is heard. And then if you have a champion in that room, such as our, oncology nurses, it makes such a difference for patients. So, like I said, I would say our nurses are our unsung heroes, and they really can be that lifeline for our patients if patients are having adverse effects. Their nurse is the first one they call. If they're scared in their treatment sessions, the nurse is the one that comes over and holds their hand and says, "We're going to get through this." So it's all of those things, plus sharing the knowledge, plus making sure patients are aware of what to expect. But it's all those things that just add up to be such an important, part of the treatment for patients. So, um, on behalf of all of us in the advocacy space and our patients, just thank you to our nurses because what a difference. We'd be lost, without them. I think, one thing would be it would be a wonderful opportunity, for our GI Cancers Alliance and all of our patients in our different communities to have the opportunity maybe to, work with our oncology nurses. Maybe that's on a program. Maybe that's on, how to improve communication, from patient to healthcare team. But I would love to work on something like that because it's so important that our patients understand, like I said, they're part of the care team, that they're kind of the captain because it's their health. But to understand better how to communicate, what questions to ask, and then how to follow through if they are experiencing adverse effects, et cetera. So I think that would be a great collaboration, whatever form that might take. But I would love to work on a project such as that.